One of the problems that can occur as men age is a condition called BPH, or benign prostatic hyperplasia. The prostate is made up of a certain type of tissue that surrounds and is continuous with the urethra. And the prostate produces certain fluids that are necessary for successful reproduction. And usually there's no problem at all. Most of the time, men aren't really aware of their prostates, but as they age, that particular kind of tissue begins to grow, just as part of aging. And when that happens, let me flip ahead to the next slide. To the left is a normal prostate surrounding the urethra and leading up to the bladder. And then on the right is a person with BPH. You can see that the tissues of the prostate have grown quite a bit, and it's pushing up on the bladder in a way that causes discomfort and gives somebody the sensation of having to urinate. And at the same time, it's squeezing the urethra and constricting the urethra, so when the man tries to urinate, it's harder for him to completely empty his bladder. So it can be very uncomfortable, and a man who has slept through the night with total ease all of a sudden might find that he's having to get up several times a night because his bladder capacity is smaller and it's taking longer to empty the bladder. Usually they're going to treat this with adrenergic receptor blockers. So they're going to block sympathetic nervous system functioning to try to encourage the bladder to be relaxed and to not be as comfortable. They also have drugs that are called DHT inhibitors, or dihydrotestosterone. Male hormones, androgens, can kind of aggravate that hyperplasia of the prostate. And so we try to decrease that. And so you have drugs like Propecia or Proscar that are good for kind of subduing the androgens. And then you probably recognize tamsulosin or Flomax, which calms down the adrenergic nervous system. One of the very valuable drugs that we're very thankful for is a drug called pyridium, or phenazopyridine. This is a bladder anesthetic. Now, I remember the days when bladder anesthetic was prescription only, and you always seemed to get a really painful bladder infection on Friday night when the doctor's office wasn't going to be open. So the day that it finally went over the counter was just a really, really great day. The most common drug is this pyridium, and it works directly on the urinary tract. It really doesn't go systemic unless you take a lot of it, but it works directly to numb those nerves that are in the urinary tract. However, and those who've taken it know that it causes the urine to just go this bright orange, fluorescent orange red, and it can stain anything it touches. It can stain the toilet if you use it long enough. Definitely can stain clothing. That's not a time to wear your white skinny jeans. And if you take it long enough, eventually it can discolor all the body fluids so that even your contact lenses will have a yellow tint to them. So you don't want to take it continuously. This drug is not an antibiotic. It's not going to get rid of infection. So on page 131, we see a safety tip at the bottom in purple that says definitely to only use pyridium for a maximum of 2 days. If you are still having pain, if you still suspect an infection, go to your healthcare provider. But by that time, they'll probably yell at you for taking pyridium, because pyridium can interfere with urinalysis. It doesn't usually have an interaction with any drug, because it usually doesn't go systemic, but it can discolor your urine if they try to look at it and do a UA. So you can't win either way, but do make sure that you go to the doctor and get an antibiotic, because the bacteria could back up into the ureters, into the kidneys, and you can have a big old problem if it's neglected. From here, we'll go into drugs that affect the cardiovascular system. So when I come back in the next slide, we'll be talking about drugs for cholesterol, drugs for blood pressure, drugs for angina or chest pain, drugs for congestive heart failure, and then we'll talk about drugs that will help the heart keep its normal rhythm.